to Health Issues. I'm your host, Chris Sylvain, and thoroughly excited about today's show. But it's very important, you know, right in a point of time in the world, not just in the United States, where there's a lot of hysteria going on about Ebola. And we have an awesome guest that's well qualified and well able to speak on this subject. We have Dr. Susan McLellan. She's Associate Professor of Infectious Disease and Tropical Medicine. If you can share more, Dr. McLellan.
Sure. I wear a couple of hats. I'm in the School of Medicine at Tulane University, where I'm a specialist in infectious diseases and teach on that side. But I'm also a specialist in tropical medicine and in the Department of Tropical Medicine in the School of Public Health and Tropical Medicine. So I have a public health bent as well.
And also a BS in anthropology, am I correct?
Correct. I did my undergraduate work in anthropology and my first overseas work doing that.
Literally, oh, awesome, yeah. Awesome. And then public health background too, master's in public health. All right, correct. And so literally kind of right at the epicenter of where we are right now. Your career kind of puts you in a perfect position to discuss this issue.
I certainly can try.
No, it's awesome. Let's cut to the chase concerning Ebola in and of itself. A lot of hysteria. My daughter called me, hey, aren't you concerned about this? I'm like, no, but tell us where we are. Should we be concerned? And let's get some background.
Well, the concern that's kind of making the news in the United States is people's individual concern about their individual health status and their risk from dying from Ebola. That should be a very, very low concern at this point. Okay. There is no reason to expect that we will have a large-scale outbreak of Ebola in this country. The means of transmission do not support it. The very fact that we have copious running water and paper towels in this country make a difference in how likely we are to have any kind of extended outbreak of Ebola. So that kind of concern should be quite low, unless you are a frontline healthcare worker likely to be involved in the care of an Ebola patient, either in West Africa or in the United States. Then your concern for becoming ill with Ebola should be extremely low. However, the concern that everybody should have is understanding that there is a huge impact worldwide on the fact that a large chunk of our world's population, not only now but in the past, has not had access to decent health care. In fact, may not have access to running water, safe food supplies. The setup in West Africa for this outbreak to become so disastrous is due to exactly that fact. These are areas of extreme poverty, minimal infrastructure, very little funding going towards health care, and that is the setting in which a virus like Ebola becomes disastrous.
So we're dealing actually more with the medical system, infrastructure, poverty problem than we are with the infection in and of itself.
Well, let's say that it makes it a perfect storm. You're dealing with the disease, and for a little background on the disease. So we think that the Ebola virus is one that lives in bats. The bats seem to be, as far as we can tell, reasonably happy with it. So they are what we call the reservoir. In other words, that's where the virus is hanging out when we're not seeing it in human populations. It can infect other primates, great apes, monkeys, and so on, and those animals become ill. When all this is happening deep in the jungle and no people are around, it's like when a tree falls in the jungle doesn't make any noise, okay? Or is with no one to hear it. So, and that's exactly what does happen episodically with Ebola. However, once it enters a human being who then is in contact with other members of the human population, that's when we have the possibility for rapid human-to-human spread. So it enters into a human because a human collects a dead animal in the forest, or an ill animal, or bat meat, or whatever, and this is not simply because, gee, people in Africa eat weird stuff. It's because there's serious food pressure there. People do not have access to a Walmart with all of the cheap Kraft macaroni you can get. It's a very, very different situation. So bushmeat, although it is sometimes a delicacy and a preference, it is also the reason people eat unusual things is also because there's not that much of the usual things around. So at any rate, so it gets into the human population somehow, and then it is a virus that in the human system reproduces very quickly and actually suppresses the human body's ability to respond to it. We know about antibodies, and there's other facets of the immune system, and the virus actually suppresses some of those, and also makes, because it affects the gastrointestinal system a great deal, makes people produce a lot of fluids, whether it's vomiting or diarrhea, and there's a lot of virus in that. It is human nature to take care of your sick wife or husband or child or mother or father. Here, in this country, we make sure that they get their head to the toilet on time, and we hand them lots of paper towels and 409 or something like that. In a place like West Africa, you have a bucket, if you're lucky, to offer them, and you clean them up with perhaps the same layer of cloth that you wear around your waist on a regular basis, okay? And if it's heavily soiled, if you're lucky, perhaps one of your children has brought an extra bucket of water from a mile away where your water source is so that you can rinse it out and reuse it. If you're not lucky, you're going to fold it over and reuse it. It's a very, very different picture than what we would see in the United States. Also, there's not a lot of health care available. You often have to pay for it in a way that may critically impair your ability to take care of your family for the rest of the month or the year. So people usually will not go in and seek care until they're very, very ill. So in this country, somebody who has a fever very often is going to present within a day or so. In a country where that might cost your year's earnings, then you may not. So the likelihood is higher that people with severe illness will be cared for at home over a long period of time.
Schools shut down. People are tracked because they were on a plane, I guess, yards and yards away. Somebody's sitting in the front of the plane, they're on the back of the plane. People are worrying about somebody, it was in the newspaper, somebody said you can catch Ebola if a person is 3 feet from you.
Oh dear, yes, and that person, well, let's put it this way. If I am very good at projecting my vomit or spit at you and manage to get vomit or spit or some other bodily fluid into your mucous membranes from a distance of 3 feet, then yes.
Into mucous membranes. So
right. So we think it's profoundly rare that people get infected via totally intact skin. Now, skin can have rashes, skin can have cuts, et cetera, and so on. But the reason we don't want to get it on our bare skin is because we tend to do a lot of touching ourselves and wiping our nose, rubbing our eye, eating sandwiches with bare hands, things like that, ways that we can inoculate ourselves very easily. There remains absolutely no evidence that Ebola is transmitted by suspended particles in the air in the way that tuberculosis is. Because it is not typically a respiratory disease, it does not cause people under general circumstances to cough or sneeze or so on. People aren't violently projecting particles out into the air. So it really does not use the mechanism of going across empty space to get anyone. It uses the mechanism of bodily fluids that are indeed full of virus that are then directly inoculated into a part of your body that is able to accept that virus, typically a mucous membrane.
Concerning the skin, I just read it, it was on CNN, and now, don't quote me if it was Sanjay Gupta or whatever, said that skin is always broken, so it's normal for skin to be able to receive.
Well, again, I think one has to really talk about levels of probability. So I've got a little scratch on my hand, and so I would not want to put Ebola on that. Now, I wouldn't want to put Ebola on anywhere because sometimes I have dry skin, and he's correct in that. But realistically, the biggest risk is your face and your mouth and any other mucous membranes that you might allow to come in contact with the fluids of an Ebola patient. So it is certainly possible if you have damaged skin, even potentially not clearly damaged skin, that occasionally virus gets in that way. But that's probably not the greatest magnitude of concern. So this was very important because we're hearing a lot about no area of skin can be uncovered when you take care of an Ebola patient. Well, I'm living proof that that's not the case. I've taken care of, in a period of a mere 2 weeks, in a very overly populated hospital in Sierra Leone, more than 100 Ebola patients. And we did not wear equipment that covered every single area of skin. We wore equipment that covered every skin that we would typically use to touch a patient or to work with our equipment. And we used shields and coverings over our hair just because it feels a little bit better to do so, but I didn't have many expectations of having bodily fluids on my hair. But I had absolutely no fear of some Ebola microbe wafting its way under my face guard. That's not how it happens. And so extreme measures to cover every inch of skin may cause more trouble if the equipment you are using, if you're not extremely well trained in how to remove it. So that's certainly one of the concerns currently that we're having, because what people think of as personal protective equipment, there's actually a huge variety which can be adequate. But exactly what you do to put whichever combination you've got on and to take it off is going to differ according to the equipment that you have. So you don't need a hazmat suit, and in fact, defining exactly what a hazmat suit means is going to depend on who you go to and which piece of equipment you're using. So personal protective equipment, we know what the bare minimum is. We know that adding a bit more to the bare minimum is probably perfectly fine, and most of us do it. We know that one can add a great deal more and function well if one is extremely well trained. But I think we are also coming to recognize that inappropriately used overuse of personal protective equipment may be extremely dangerous as well.
I want to come back there. I want to hit a point, this contact through inanimate objects.
Mm-hmm.
If somebody that had Ebola that was sweating touched this table,
right,
and somebody came back an hour later and touched
right,
the table, sipping
right,
a cup, somebody drank from water, a
right,
kid that had been on a plane 2 weeks ago with somebody and then they sipped a cup, those types of things.
Right. So one thing that seems quite clear is that the risk of getting any kind of infection from somebody who has not yet developed symptoms, right, any symptoms, is profoundly low. We also know that the risk of getting an infection from somebody who is early on in their symptoms from casual contact is extremely low, because the virus reproduces and reproduces, but it takes a few days to really get rolling. So people who are early in their illness, early enough to be comfortably wandering around and performing their daily activities, are very unlikely to have as much virus as they might later on when they're very ill. They are therefore less likely to transmit that virus. Whether at an early stage of the virus, of the disease, virus can be identified in sweat, we don't even know. Okay? We know that later on it probably can, but that's not primary mechanism. Also, we know that this is a very fragile virus. It doesn't get along well sitting in a dry spot. Okay? So, were a patient to vomit upon this table, okay, virus could last there probably for quite a while it was wet. Once it was well cleaned up and allowed to dry thoroughly, the chance that it would continue to survive on that is extremely low. So the types of bodily fluids that are likely to cause potential infection are visibly unpleasant bodily fluids, not a touch of sweat. So, and again, from somebody who is ill. I have no qualms about the fact, and I didn't even when I was before my 21 days, that I had hugged someone who I knew later became ill before she was symptomatic. That's not something that put me at risk.
And you're speaking out of compassion also, but literally dealing with probabilities. You know, New Orleans is a big gambling place like Las Vegas, and so I always say that it takes a certain understanding of not necessarily statistics to understand odds.
Yes.
People that gamble, I always say they really don't understand odds, and I think could be what we're dealing with here. That 1 in a million seems big to people.
Yes, and it's also human nature to become fairly relaxed about the risks we take every day, such as getting in a car and taking a car ride.
Really?
Any of those other things that we do, and we don't worry about it too much. But certainly the risk of being in a car wreck in New Orleans is higher than the risk of getting Ebola right now, by far, but nobody is worrying about getting in the car. Some people aren't even worrying about putting their seatbelts on, getting on a bicycle and riding around without a helmet. All of those things have a much higher risk than the current risk of contracting Ebola because somebody was on the same airplane or in the same airport or even sat in the same chair 5 minutes before you. So there's risks that we all come to happily relax with and not mind, smoking, all of those things. But a new and very different risk always changes our perception. And that's fair, that's human nature, but there is a point at which one does need to sit down and take a deep breath and look at the science. There is no such thing as a risk-free life. And we choose our risks and we choose what we can manage, which risks to avoid, and we also choose to accept certain risks that are extremely small. And right now, the chance that one could get infected by going to school with a child who may have been with a patient before they got sick, that's a risk that I think is so minimal that it is vanishingly approaching zero and should not be one of the risks that we consider unacceptable.
And I use this analogy, and I don't know if it's a good one, but it makes sense to me. We had the same issues with the hurricane issue of the city, where science was saying one thing, but hysteria said something else. How does the truth really come out to override the forces of the media? Somebody was mentioning the necessity of the 24-hour news cycle, the politicians, and taking it to political ends.
Right.
What do we do?
All we can do really is ask people to educate themselves from reliable sources. Now, it is hard to offer that to people if they have become convinced that there are conspiracies out there and that the government is trying to hide things and so on. But the truth is, then they can go to European websites if they prefer. But there is science out there. There is information out there. And it is unfortunate that it's always more exciting to be frightened than it is to be calm. And also that in the overabundance of caution, which has been displayed especially by certain local officials about requiring people to be quarantined or things like that, tends to convey sometimes to the public that they know something that they're not telling us. And that's really not the case. Officials are under all kinds of pressures to do something that makes other people feel safe, even if it is not making them any safer. And I think we're seeing that over and over in situations where people are being asked not to come to work or to
LSU.
Or to self-quarantine and so on, especially when there's been no significant contact. I do think it's quite appropriate to have active contact and active contact tracing if someone has had clear, recognized exposure to an ill person. And even if in a situation where it wasn't clear that they had recognized exposure, and now it is, and that's what happened in Dallas. So those things are completely appropriate.
Shutting down the borders.
Again, certainly not likely to help in any way stem the epidemic at its source. Probably unlikely to stop people getting here very well. Again, over and over, what we need to do here is be educated and prepared and careful and put a lot of resources into stopping this thing at its source.
In West Africa.
In West Africa.
And that's where the money and time and effort should be spent. The nurses were protesting, and that's, I think, to even finish up a little bit in that area. They, big pictures of the nurses protesting, saying that they didn't get proper equipment and so forth. And I think where we're at, help us on. I mean, you spoke about it, but if we can kind of grab a little bit more there.
Now, I can't comment on any specifics of what was provided, what was given. I have absolutely no insider knowledge about what's happened. I can only comment on some comments that I have seen in the news. Okay. So one comment that I have heard is that the suits provided, the equipment provided, didn't cover every inch of bare skin. And therefore, some healthcare workers were uncomfortable using them, and perhaps with advice from higher-ups, basically created some sort of over and above measures that they were using, feeling that that would help them more. There was complaints that training was not offered, was not available. Again, I don't know specifically about that. All I can say is that down the line, what needs to happen is not just availability, but sometimes a little pressure to get trained from above, that every healthcare worker ought to be taking it upon themselves as well to try to access training that they can get online or whatever, but also provision of the resources both to train and then to perform the care. Resources to train means individuals need to have the opportunity to practice taking on and taking off the specific gear that will be used at their institution. That's difficult. That is extremely difficult to get everybody to do that. But that's one of the things down the line that we want to have happen. And then a very clear understanding of what is safe and what is not. And then a very clear understanding of how you get it off being safe. But to me, I mean, nothing that's happened, and I think this has been stated by officials at CDC and so on, nothing that's happened has told us there's a new method of transmission that we didn't understand. What it has told us is that it is very, very hard to get everybody prepared and to have every step taken care of. And that's a very fair and valid concern for healthcare workers, not for the general public in terms of it's now going to spread outside of healthcare workers. So I think the nurses probably had some valid complaints. I think, however, also some of the representations of nurses' statements that I've heard suggested that there was some misunderstanding about likely reasons for transmission as well. So education and believing in the science is really vitally important all down the line. And we have talked about nurses because you talked about the nurses who are protesting, but it is exactly the same things are true of physicians, of environmental cleaners, healthcare worker, environmental services people who have to deal with cleaning up, and with security people, police, transport people, anybody who might be involved in the care of a patient. We need to do everything possible to make sure that they are well educated in what the science tells us and that they know how they can protect themselves on a day-to-day basis.
Yeah, literally, because the plane was quarantined. Those types of things. The nurse did get the virus from the patient, from the gentleman. I guess there's 2 nurses now, whatever.
Correct.
Okay, and that focus seems to be on the taking off of the gear. Is that correct? I mean, we don't know, but it seems to be the concern.
There's nothing known precisely, but as from what's reported in the news, there was no needle stick. There was no known splash that contacted mucous membranes or even bare skin that I have seen anything about in the news, but I get my info about this from the news.
Right.
So I think that with the recognition that the taking off process is where you have some parts of you that may be contaminated and some parts of you that are bare, that is the most likely time that one could accidentally contaminate an area of you that you're going to walk out thinking is clean and could later touch and transmit or something like that. So that is purely a supposition that is the time period of highest risk. It's not known for those individuals exactly at what point there was a problem.
That's how it happened. But again, we're dealing with fluids, and actually, like you said, and I think the key what you said is unpleasant fluids. We're not, sweat is actually different because that's, we hadn't heard that.
Again, I need to say that with an extremely ill patient, sweat may be a consideration.
Okay.
But probably not before they're feeling sick.
Hey, Dr. McLellan, thank you, McLellan, thank you so much. Hey, learn, study, listen to the right information, health issues. Thank you. Have a great day.